heart attack, which is medically referred to as a myocardial infarction, is characterized by permanent damage to the heart muscle due to the lack of blood supply. Under such circumstances, one usually experiences symptoms such as pain or a feeling of pressure in the chest, nausea, sweating, dizziness, anxiety, shortness of breath, pain radiating to the arm, jaw, and back, etc. There are times when these characteristic signs and symptoms don't appear. Such a silent or atypical attack is quite dangerous, as one might ignore it, thinking of it as a case of indigestion. These atypical symptoms are very hard to recognize. It has been observed that women are more prone to develop atypical signs than men. This makes early detection impossible. Thus, it is important to be able to identify these symptoms so that medical help can be sought immediately, if the need arises. Atypical symptoms of myocardial infarction. Besides women, old people or people with diabetes are also susceptible. Here are some of the atypical symptoms of a heart attack: nausea, sweating, headache, dizziness, heartburn, sudden lightheadedness, tingling sensation in the left arm and shoulder, palpitations, bloated stomach. Symptoms in women. Women are less likely to show typical signs of a myocardial infarction than men on an ECG. This makes it very difficult to seek timely medical help in case of a cardiac arrest. Besides the aforementioned symptoms, a few other atypical signs that are specific to women, and might be felt prior to the attack include flu-like symptoms such as fever, chills, headache, cough, sore throat, and body ache before the attack. Many women tend to have a mild burning sensation in the upper abdomen or indigestion. Nausea and vomiting that might accompany indigestion. Women may experience pain in the arms or between the shoulder blades. Discomfort in the chest region. Unusual fatigue. Sleep disturbances. Shortness of breath. Anxiety. Feeling of fullness. Tingling sensation. Since these symptoms are very vague, these are often mistaken for general sickness and prompt medical help is not taken. Women in the high-risk groups for such attacks include those who smoke, and the ones who are affected by diabetes, high blood pressure, family history of heart disease, obesity. Those who come in the high-risk groups must go for checkups at regular intervals. Do make the necessary lifestyle-related changes to lower the risk. If you have any further queries about atypical symptoms of myocardial infarction, speak to your healthcare provider for more details. Disclaimer: the information provided in this article is solely for educating the reader. It is not intended to be a substitute for the advice of a medical expert. A heart attack, which is medically referred to as a myocardial infarction, is characterized by permanent damage to the heart muscle due to the lack of blood supply. Under such circumstances,